Sexual transmitted diseases. Sexual transmitted diseases, also called as STD, may be caused by microorganism or viruses such as chlamydia, gonorrhea, syphilis, herpes, trichomoniasis, bacterial vaginosis, hepatitis, HPV and HIV. STD is a commonly acquired infection worldwide and is increasing in prevalence. STD symptoms in women may range from none to severe life-threatening pelvic infection, medically called pelvic inflammatory disease or PID. Consider STD with following symptoms for those at risk group: abnormal vaginal odor or discharge, genital discomforts such as soreness, itching and burning, painful sexual intercourse with or without vagina bleed, painful urination with frequency, lower abdominal ache. Men with STD are more likely than women to have no symptoms of complaints, especially infected with trichomoniasis and chlamydia. Diagnosis may be delayed due to no symptoms. Therefore, screening for those at risk may facilitate early diagnosis and treatment, in particularly chlamydial species. The United States Preventive Services Task Force, hence recommends chlamydia screening for all sexually active women aged 24 or younger. Screening is also recommended for those at-risk women aged 25 or older. The so-called at risk is defined as a new sexual partner, multiple sexual partners, a sex partner with concurrent partners, a sex partner has STD, previous or coexisting STD, inconsistent condom uses in the background of multiple sexual partners. It is good to note that unlike other STD, trichomoniasis may be non-sexual in transmission via fomites like towel, toilet seat and public swimming pool contact. In vaginosis, it's less clear-cut how sex transmits vaginosis, but it rarely affects those never had sexual contact. Unlike vaginosis, which has a tendency of natural resolution without treatment, most other STDs, if left untreated, last for years. Untreated bacterial or protozoal STD is associated with higher HIV transmission, low birth weight and prematurity in pregnancy and infertility due to pelvic infection. The diagnosis of syphilis is difficult due to its nonspecific nature of presentations, in particularly advanced syphilis. Primary syphilis is generally associated with genital lesions months after sexual contact, whereas advanced syphilis may manifest as skin rashes and neurological symptoms. Two virally transmitted STDs may be prevented with effective vaccination programs, namely Hepatitis B and human Papillomavirus or HPV in short form. Hepatitis B vaccination is part of routine childhood immunization worldwide. HPV vaccination is recommended as low as age 9 and up to 26 years old. A shared clinical decision is suggested for those aged 27 to 45, in particular at-risk group. HPV vaccination is most beneficial when administered before first sexual contact. HPV vaccination, however, does not prevent progression of HPV infection to disease, reduce clearance time, or help curing HPV-related disease like cervical cancer. HPV vaccination is a preventive measure. Prevention is always better than treatment. The treatment of STD is mostly antibiotics except HIV, which requires a long-term antiviral therapy, much like treating chronic diseases such as hypertension and diabetes. Take-home message: safe sex. Prevention is always better than cure. Leave the comment below the video and I will try to reply as many comments as possible.